Hey guys, so I want to do another video on mental health. Um, so I'm here right in my bedroom slash office area, um, enjoying my 2 weeks off for Easter. Um, there are my shirts to be ironed. Please try and ignore those. Um, Obviously, it's about mental health again. Um, and my skin is very red, just to point that out, because I've had a facial and I've been on sunbed, and obviously I've dyed my hair pink, which I'm actually going to move on to because it's quite important for this video. About the way that some drugs or medicines, um, I don't really like to call them drugs because it gives you the impression that you're using them illegally, like medicines can cause really weird side effects. So, as you know, for my eating and also for my other mental health issues, I've been taking antipsychotics and antidepressants and other drugs like benzodiazepines and sleeping pills for a long time, just to try and sort of stabilize things. And I'm trying now to use more natural things to do it, which is a bit to my psychiatrist's dismay. I guess he just wants money out of me in a way, but also wants the best for my mental health. So I had the discussion about quitting my antidepressant. So again, I'm not going to give this as a medical expert or anything. I'm just giving this as my personal opinion. I believe antidepressants are useless. I've tried sertraline, escitalopram, citalopram, mirtazapine, and my latest one I was on was fluoxetine. Excuse me, I need to have a drink. And the fluoxetine just did nothing. There's a really bad side effect associated with antidepressants, which belong to an SSRI class, which stands for selective serotonin reuptake inhibitors. Now, I'm going to talk quite a lot about the technical names of drugs, just because I've learned to sort of kind of know what they are because of my mental health issues. But they cause one major side effect, which I won't go into, but it's pretty much something that no one would want to experience, especially a 24-year-old male. So that's the reason I decided to quit those antidepressants. And they weren't really doing much for me. I was on 60 milligrams of fluoxetine, which is a maximum dose. The normal dose is 20 milligrams, and it just wasn't doing anything for me at all. It wasn't making me less depressed. It wasn't making my anxiety any better. It was mainly for anxiety and also my bulimia. Then I was taking my antipsychotic olanzapine. Now, there are two types of antipsychotics. There's typicals and atypicals. This is an atypical, which means it's newer. I think it was developed in like the 1990s. And I stopped taking olanzapine, or I asked my psychiatrist to switch me because of the side effects. It causes weight gain as one of the side effects. Although I'm not overweight by any means, I'd gone from like 60 something kilos to like 80 odd kilos, so I asked my psychiatrist to switch me over. I was then switched on to a drug called haloperidol, which is an antipsychotic, which is an older one. It was developed in the 1950s. And that was a nightmare because it caused these muscle spasms, and the only way I can describe it is a side effect of them. My neck would be like this, and I could not move it straight. So that's why I decided to quit haloperidol. I was then switched on to a different antipsychotic called risperidone, which is also used to treat autism as well as bipolar and schizophrenia. And I was given 3 milligrams. This was my starting dose, which is quite a high starting dose, to go up to 6 milligrams, which is my maintenance dose. And I haven't taken that for a week now, my antipsychotics, which might be quite controversial. I've told my GP, I haven't told my psychiatrist because I haven't had an appointment with him yet. Things are worse slightly mentally in terms of my illness, but my eating wise and the side effects I think outweigh that. I'm less tired all the time. I have more energy on wanting to do things, and the side effects I spoke about with the SSRI antidepressants are also reducing. So the way these drugs work, risperidone, is they increase the amount of serotonin in the brain and they block dopamine. So they change the chemicals in the brain. So the imbalance of chemicals I have in my brain, it causes them to rebalance. But what I found with the drug is instead of causing them to rebalance, it actually made me more manic. So one of the phases is mania, which is where you have this major feeling of happiness. And I found that the antidepressants and the antipsychotics, when mixed together, caused this mania that was crazy. So I just wanted to do things out of the blue. Like, I got my cartilage pierced out of the blue. I don't regret it because I wanted it done, but it was the most random thing ever, and I'm not a very spontaneous person. I bleached my hair and dyed it pink all within like 2-3 days, and then afterwards kind of thought, crap, I have to re-dye this when I go back to work, because work aren't going to allow it. And it makes you do really, really random things, which is what I touched on the beginning. It just makes you this manic person for a while you're coming onto the dose. And although I knew that would ease and the tiredness would ease, then I wasn't really willing to put up with the side effects for a good month or 2 months while they were easing. The other one thing was the mixing with alcohol. They didn't mix with alcohol very well. Haloperidol especially, the first one I talked about, which caused the muscle spasms. 1 glass of wine would make me like asleep. Literally, like 1 small glass would make me asleep. And the same with the risperidone and the olanzapine. They would make me really, really tired. And even if I tried to take them at night, they would cause like a hangover effect, which is basically the same with alcohol, but with the drug, where I'd feel awful the next morning. So right now I'm trying to like control my symptoms. I am going to keep taking my risperidone because I have to keep taking an antipsychotic, or I have to at least be cheeky and get the prescription for it so they think I'm taking it. But I'm going to take it at a lower dose, so I'm going to take just 3 milligrams instead of 6, and my psychiatrist is aware of that. That's one of the other side effects as well of antipsychotics, especially these newer ones. They make you really, really thirsty. I'm drinking like probably, this is half a litre, so I'm drinking probably 10 to 12 of these a day. I'm constantly thirsty for water. So I'm trying to treat it with non-medicinal means. So more sort of like herbal remedies. So I'm using something called acai berry, which is an antioxidant, and you can take you take 1 or 2 capsules up to 3 times a day, so 3 to 6 a day. So I'm taking 4 a day, and it's an antioxidant, so it just makes you feel better generally, mentally and physically. I'm then taking Wowman, which is an antivitamin, but it's a specialist brand one, so it's a vitibiotic, which means it's good for gut health. So with my bulimia, when I'm like throwing up, it's good for rebalancing the gut health. I'm also taking something called Melacarb, which is a prescription drug, which is for sickness. I'm also taking something called melatonin, which you can buy in 10 milligrams. Now, it's actually a prescription-only medicine in this country, but I can get this shipped in from America, and that's actually not illegal. So it's not illegal to possess a drug, unless it's a controlled drug, which I'll move on to in a minute, without a prescription. So you can get this shipped in, you just have to pay a tax on this. This is about £20 for 120 tablets. I'm also taking another, that is for sleep, by the way. So you take 1 at night for sleep, and basically melatonin is something our body produces naturally, and it helps you aid in your sleep, which reduces my anxiety at night as well. The last drug I take is diazepam. So I was taking a medication called alprazolam for a long time, which is Xanax, to try and control the worst of my psychiatric symptoms, which I was prescribed. And then I was also prescribed lorazepam and clonazepam, which are also, they belong to a class called benzodiazepines. So these drugs work basically by slowing down the brain. So the messages in your brain, they can't travel as quickly, so they just slow down the brain and they make you very sleepy. I became addicted to them through chronic long-term use that I was prescribed them, and like I have admitted to some people, and I will admit now publicly, that I have bought them illegally, although I have them prescribed. This is diazepam, which I have on prescription, which is, you probably heard of as Valium, and I'm to take 6 of these a day. That's my weaning off dose, and my dose will gradually get lower. I don't think I'll ever come off it. My psychiatrist has said he has no long-term goal for me to come off it, because it does ease my anxiety, and it's the only thing that works. My anxiety related to my mental illness, which can also be caused by the antipsychotics, which I have to take. It's so severe at times, that's the only thing that works. And this is a controlled drug, so to get this off prescription is a criminal offence, so I have to get refills for this. I would never recommend taking a benzodiazepine like diazepam or anything like this, because this is very addictive. I'm only taking it to wean down the dose and to be put on a more stable, lower dose. So my anxiety is so bad, and I would only really recommend it for severe anxiety. And to be fair, a doctor or psychiatrist would only prescribe it for that reason, hence why I have it. And as I said, it is illegal to possess that without prescription. The other thing I'm taking is something called propranolol, which was originally developed to treat blood pressure, but now it's developed for anxiety, so it slows your heart rate down. So that feeling you get of a pumping heart rate, sweaty palms, like sweating, like the feeling of inner turmoil you get with anxiety is basically reduced. And I was taking 3 10-milligram tablets a day, and now I'm just taking 1 80-milligram in the morning. So it's reducing my daily tablet needs from about 18 tablets a day down to about 11, because I've had some of my others reduced as well, which is quite good. Or not reduced, but I've had them put into 1 capsule, so I don't have to keep taking them throughout the day. So yeah, my thoughts are that, number one, and I want to say all of these thoughts are my own personal opinions, and I'm not doing this from medical experience or giving any medical advice. That's my disclaimer, if you like. My first thought is, number one, I think antidepressants are useless. The side effects I'm not going to go into because they're personal, but you can Google it, and all I'll say is, for a guy in their 20s, it's not something you want to experience. And that goes for all antidepressants, in my opinion. I don't think they work, and I think the side effects outweigh the benefits, and they take too long to start working. They can make you worse for the first couple of months. And that goes for all of them: sertraline, citalopram, fluoxetine, all the ones I was on, none of them worked. Antipsychotics. Unfortunately, I'm in a position where I have to take them probably for the rest of my life. I'm going to try and take the lowest dose possible and try and find one with the least side effects. That is, I don't want one with these muscle spasms, I don't want one causing weight gain, I don't want one that's causing anxiety. The diazepam, again, I'm probably going to be on it long term, just on a lower dose, because the Valium does curb the anxiety, and the melatonin is just a natural sleep aid. So the best I can, I'm going to try and use natural remedies along with the therapy I'm having to try and combat and fight my mental health issues. Over the last week, since I've not taken the fluoxetine, so fluoxetine has a half-life of about 4 days, which means that when you take 1 tablet, it takes 4 days for half of it to be got rid of from your system. Even though it's been about a week, so about just over half, about 70% of that drug will have gone out of my system, I'm feeling a lot better already, and the risperidone is going out of my system slowly, and I'm also feeling a lot better. Mentally, my symptoms are actually slightly worse, but the side effects are better, and I feel like that outweighs the psychiatric symptoms. So yeah, that's all I have to say. I would say don't rely on antidepressants, is my personal opinion. Look at therapies, look at self-help guides, which I use. I have self-help books, which I use. Herbal remedies are really important. I also use something called NAD. Now, there's 2 ways you can have it. It's quite expensive either way, unfortunately. So you can buy a box of tablets, and I don't have the tablets. So the tablets are, I think, about £70 for a month's supply. Or you can have it via infusion, so intravenously through your vein. And it's much better through infusion. So when you start having it, you have 1 course every day for 5 days, which is £500 a day. So that's quite expensive. That's £2,500. And then I have a maintenance course at £500 every 2 weeks. And that is a drug which helps reduce addiction and reduces psychiatric effects. And it's not a prescribed medicine, it's a natural remedy. But for me, I've really found a benefit. So anything like that, and if you couldn't stretch to the intravenous form, you can buy the tablets from literally £30 to £40 for a month's supply. So it would really be worth it if you're really suffering. So I guess my main message is not to rely too much on medication. Look at alternative measures, look at self-help techniques. I'm going to have to rely on medication long term, but I want to try and aim for the lowest dose and the least prescription ones or drugs as possible. So thank you, and please give me your comments on my video.